Hi, I'm Dr. Adam Fields, and with some help from an acupuncturist friend of mine and a scientific study on tear film breakup with acupuncture, we're going to see if we can help some of you with some dry eyes. We're going to start by doing some of these points on my face. A soon is actually a measurement that goes from the middle finger right here, just like this. So one soon, yours is different than mine, back from your hairline. You're going to go to a point. You'll see I have a little sticker on there, and you're going to do some massage on there. I want you to massage that deeply. Get your finger in there. The key is see if you can get some, a little pain, a little soreness is good, right? It's not necessarily, okay, I landed perfectly on that point at that time, but try and relax your head a little bit. I'm talking so it's not as relaxed, but just let yours go for a second and just really push into that spot. Let's brighten those eyes up. Let's get some lubrication in there. Good. Close your eyes for a second and just do some circles right on that spot. Here we go. That feels great. Just work it a bit. You can do this video a couple of times a day. You can pair it with some acupuncture or maybe some endonasal cranial adjusting in my office. Okay, we're going to go to BL2. We're going to go to the inside borders of the eyebrow. Just take your middle finger and just get in there and let's work that. Some circular motions. I know a lot of you have had to even move to new areas. A lot of people with dry eye syndrome don't live in the desert. They find homes near the ocean where there's 49 inches of rain a year or whatnot. They're moving to Portland, to Tennessee, to moving away from Death Valley. And just work that. Just work up and down. Good. And side to side. You can go kind of fast on this. And circular motions. Good. We're going to bathe. Sometimes the eyes, a lot of you are sleeping actually with your eyes slightly open. You're not getting enough nourishment to those eyes. So we're going to have the eyes closed right now. And so your eyes are going to track up and down, up and down. And make sure the eyes stay shut. Don't let them part at all, especially when you're going on that uptick. The eyes up and down. You'll feel them want to open up, but just keep them closed. Good. Hang in there. Keep going. Think about as you move your eyes, they're just being coated with this beautiful film of tears. Good. Now we're going to go side to side with your eyes closed. Keep going side to side. Good. Keep going left, right. Even push into that end range motion a little bit. Push yourself on this. Get something out of it. Here you go. Now we're going to go to another spot, and we're going to go right where your pupils would be, but above your eyebrows, in the center of your eyebrows. You'll see I have a little point there, and we're just going to go, it's one soon above. So this much above your eyebrows, right there. And again, find that little tender spot. Use your pointer finger, and let's see some circles. Good. Nice to be hanging out with you today. Let's get you lubricated. Let's get some movement, increase circulation around those eyes. Go for it. A lot of you have given up. And I tell you, there might be some hope here. So let's keep going. Really push it. You'll feel that tenderness. You really will. And if on your spots that are especially tender, you want to go back and do those throughout the day even. Good. Now we're going to head right over to the lateral tip of your eyebrows, right here. Good. There's all these fun names with these points. I think this one is the silk bamboo. Let's get those eyes silky. Good. Move them. Again, find a tender spot. Tap into your body. What does it want from you right now? What is it telling you? Close your eyes. Really get into it. Good. Now the plinking exercises, keep going, can be done throughout the day also. In fact, a lot of people say when you're trying to help dry eye syndrome, you do blinking exercises every half hour even. So if you want to pair that with this, great. Really just take this time in your life. Take 4 weeks and just go for it. There we go. Getting a little release in there. So now we're gonna just chest is up, let the arms relax, and I want you to blink, close your eyes, pause for a second, open, relax, close again, pause, open. Really, when I say relax, just let those eyes relax. Now close them and squeeze them a bit, squeeze them shut, and then open, and then relax, and then close, squeeze, open, relax, close, squeeze, open, relax, close, squeeze it, strengthen these muscles a little bit, open, relax, couple more, close, squeeze, open, relax, one more, close, squeeze those eyes shut, open, relax. Good. Let's go right in between your eyebrows. You'll see I have a point there, right in between, a little bit, actually maybe a little bit up. Find that little ridge in there. It's called the Procerus muscle also. And then just circular motions. Beautiful. Circular motion. We don't want tightness in here. We want looseness. As I say in a lot of my videos, a lot of problems can just be plumbing issues. Circulation, right? We want to get things moving, circulating in the body. Blood flow is so important. Cerebrospinal fluid flow is important. And tear flow is incredibly important. So just keep doing some circles. This one's called yin tang. Oh, that's good. Now let's go up and down with that. Just up and down. And circular again. Good, so next we're gonna go below your eye, but underneath, above that orbital ridge right there. You'll see I have some stickers there, and we're just gonna push right in there and just get in there and do some circular massages. You don't really need to gouge your eyebrows on this one. Just get in there. Again, close your eyes if need be. Nice, letting it relax. Circular motions. You might find a little tenderness in there. You might find it on the bone, you might find it just above the bone. I think massaging the extraocular muscles even, which I do in some of my eye strain videos, is really underrated. It really is wonderful. You can even mobilize your eyes and stretch out trigger points in those muscles. Let's just go ahead and just work that a bit. Beautiful, good job. Okay, the next one is the suboccipitals. I mean, they are so important. In fact, they say you've got eyes in the back of your head. Well, visual processing is really gathered right there in the back of your head. So go ahead and just give me your hands, just interlace your fingers, put your hands, or if you have to do it wide, that's fine. And you're gonna go right with your thumbs right here and just start working this area, just up and down, just massaging, sort of moving the skin, just like that. You can work the thumbs. Ooh, this is a good one. The value of the suboccipitals. I mean, when those suboccipitals are free, a lot of us have tight suboccipitals from altered ergonomics, and when you get them moving, it just posture changes. People have more wakefulness. That feels good. So just work those suboccipitals with those thumbs. If you have to, come out here. If you can't interlace your thumbs, just come out with your mid fingers and just go for it. If you have to, get the head forward a little bit. Beautiful. Feel that circulation just pulse throughout your entire head. Feel that energy flow just increasing in your body. This is grand central station for your body. We want that energy traffic to just keep moving, radiating from the tips of your fingers to the bottom of your feet to the top of your head, just radiating out your eyeballs. Good, now we're gonna do something called an occipital lift. Take the joint right here on your thumb, right here to your temporal actually it's called the mastoid process. We're gonna go each side, and we're gonna just lift like that. Lift that head and pull it down on the other side, and lift the other side. Good, this is your temporal bone connected to your occipital bone. Keep going. Good. And let's go ahead and move it back a little bit to your suboccipitals, right there. So move that hand back and push the head more at a 45 degrees on this one. 45 degrees. Oh, loving it. Let's go 10 more. 1 and 2 and 3, 4, 5, 6. If you have a headache, it might just go soon. 8, 9, 10. Good. So the next moves are unilateral. The men, you're gonna work on the left side of your body. Women, you're gonna work on the right side of your body. So we're gonna start with the hand, right? We've got this one point called supreme abyss, and it's gonna go between your radial artery and this tendon right here, and we're gonna go right here with your thumb and do some muscle work right there. Ooh, that feels good. I have a little tenderness in there. This is phenomenal. Good. They say this helps with lung energy. Beautiful. Just keep working it. Oh, I have a little tenderness in there. And if you do, find it, work it, people. Rep it out. It's so good to just give yourself some real good direct care, some care to your body. And this is backed by some science. It's pretty exciting. In fact, this next point right here that we're going to go to, it's called LU10. It's the midpoint between this bone right here on your thumb. So let's go ahead and just work that just right there with your pointer finger. This one has been shown, interesting, to help with acute asthma. There was a randomized control study right here with asthma. Go figure. Who figured this stuff out? This is wonderful. Thank you. Those who dug the well that we are now drinking from, all this great science, I love it. Okay, keep working that thumb. You'll probably feel some soreness here regardless, just because you use this thumb a lot. But find that tender spot, find those spots that are just speaking to you and saying, hey, help me, I need some help, give me some love. All right, now the next one, make a fist, and where your pinky lands, there's where you're going to be doing a little massaging, okay? Just work that spot. Ooh, that's good. This one they say is good for the mind, emotion, decreasing stress, even helping sleep. Love it. Just work that spot. Give it another 10 seconds. You got it. Good, so let's do some eyes closed circles. So go ahead and just close your eyes and just work the entire range of motion of your eyeball, like you're making a giant circle. And let's do 10 of them. Just keeping, especially that upper arc, that all the way up and around and down, up and around and down. We often are really strong in the lower arc because we're looking down at our phones, etc. However, this is really the opposite. Now do a big circle in the other direction. Let's do about 10 of those too. Again, you might find in that upper arch that your eyes sort of flutter a little bit. It's because the muscles are being worked. Good, and a couple of those blinking exercises. So open your eyes and let's go ahead and close them. Squeeze, open, relax, close, squeeze, open, relax, close, squeeze it, open, relax. Something as simple as keep going. Squeeze and open, relax. Keep going. Just the eyes, just being able to work the eyes. Squeeze, open, relax, squeeze, open, relax. Beautiful, you did a great job. We'll see you this evening or for your next video this evening. And I'm so glad you're here taking care of yourself. Please let us know if this helped. I want to hear your comments.